If you were to like say top tips for somebody to mitigate premature aging and a lot of that erosion and things that they should be focusing on in their lifestyle, nutrition, what would you say are the big areas for people to do?
Number one is sleep. It is the ultimate rejuvenator.
Yeah.
There is nothing more evolutionarily necessary than sleep. You could argue many of these chronic diseases are attributed to poor sleep quality. Just look at sleep apnea that impacts heart disease, that
Mhm.
impacts diabetes, that impacts hormone levels, weight loss or weight gain, etc. So number one would be sleep. You need to not just get 7 hours of sleep, you need to get 7 hours of refreshed sleep.
Do you guys know how difficult it is to find a high quality supplement line that doesn't just destroy your gut? Most pre workouts and post workouts, or even like on the go snack options like beef jerky or protein bars, they're terrible for your gut health. They're full of xanthan gum and guar gums and fillers and artificial sweeteners, which disrupt your gut microbiome and lead to chronic bloating, constipation, diarrhea, and not to mention when our gut is off, all of the other symptoms like hormone imbalances, thyroid issues, mental health issues, which is why I'm just obsessed about gut health. But anywho, I have not been able to find a good supplement line out there, and I had to cut out all of these fitness type supplements when I was really struggling with a lot of my own gut issues until recently I found Paleo Valley. And Paleo Valley is one of the first supplement companies that hands down is incredible for your gut health, whether you're on a gut healing journey or you're someone who just wants to optimize your gut health and overall health. Their founder, Autumn, actually suffered with IBS herself. So she created this entire supplement line specifically to be gut friendly. And I'm not lying with you guys. Their whey protein powder, which is grass fed and finished, gum free, artificial sweetener free, no issues, no bloating, no constipation, no diarrhea, no upset stomach, which is literally like the first time in my entire life that I've not had issues with a protein powder. And they even have super yummy grass-fed and finished beef jerky sticks, which are made with a collagen casing instead of the typical citric acid casing, which is terrible for your gut health. And if you want to try out some of their other products, they even have a bone broth protein powder. I love adding that into whether it's like my oatmeal in the morning or my protein shakes. It literally tastes like the Nestle hot chocolate powders, if you ever had those as a kid, which were not gut friendly. And then they have great supplements too, like their apple cider vinegar capsules or even their turmeric capsules, which are great for inflammation and gut health. So if you want to get a discount, you can use my code using the link in the show notes here, which is paleovalley.com/Rachel Scheer podcast. But all of that's going to be in the show notes. So check out the supplement line because, guys, you know me, I would not have this on my podcast if it was not awesome and gut friendly. I am curious as to what got you into the line of work that you do, especially that you do so many different things now. And I'm sure maybe you had a story that really got you into this space.
Yeah, there are actually quite a few stories as to what really got me into the space. And there's everybody has a personal story of why they got into this and what really brought them to integrative medicine, mostly because it's a field that you really need to be passionate about because it is essentially a very steep hill to walk up.
Mhm.
Because it is essentially at every walking point or stopping point, there's some type of proving or controversy or debate on whether something is real or actual or effective or not. There's two major things that actually impacted or I would say three major things. Number one, my father has been or was sick. He passed away 3 years ago, but ever since the age of 7, my father was sick, or ever since the age of when I was 7. So ever since I was 7 years old, my father was sick. So he's pretty much sick my entire life. Right? There's not really a lot you can remember before 7. When I was 7, he was 47 and he had two heart attacks at that time. So I saw my father basically on close to dying
Mm.
twice. And I remember 7, 8 years old walking into the hospital and looking at my dad on with a bunch of tubes and wires and picks and etc. On oxygen. And I was like, I'm so glad that he's in the hospital and somebody's here able to help him. Like, thank God for medicine and what they can do to get my dad better. And I was very relieved. And every time I saw him unwell, I thought, oh, okay, well, medicine must have some, like the doctors must have something to help him. And this happened probably every 3 to 4 years up until the time that he passed away, where there was something wrong. So he went from uh, heart disease to peripheral artery disease to emphysema because he was a smoker. Um, he struggled with alcoholism. So there was that part of it, the mental health aspect of it.
Sounds like my parents.
It's tough. I understand how a lot of people have challenges mitigating it or managing it, whether they're experiencing it or they're a child or a sibling or a family member of somebody. But it has an impact on the entire community, not just the person. And so then there was that, and then he went into he had leukemia, and then he eventually passed away. Oh, and then there was this he had a essentially a heart attack of his colon, colonic ischemia. So basically, he lost blood flow to his colon, and that caused a lot of other issues. So chronic GI issues there for him, and then eventually passed away with Alzheimer's.
Mm.
So probably every
Yeah, like
3 years.
everything. He was pretty unhealthy.
Yeah, so I would tell everybody if you want to look at the top 5 to 10 killers in America, my father had the
Like
top
all of
five.
them.
Yeah, and then he had sarcopenia towards his end of his life, a
Mm.
lot of muscle loss, wasting, etc. So anything that you can name that will take somebody's life and reduce their health span, my father had it, and it also reduced his lifespan because he didn't live very long until he lived till like 72.
Mm.
So there were a lot of things in there that I thought that medicine could help. And when I was in undergrad at NYU, I majored in nutrition, and I told my advisors, I'm going to major in nutrition, and I'm going to uh, also major in pre-med. I'm going to go to med school, and I'm going to teach people and treat people with nutrition. And met with 3 advisors, and they were like, "No, you're not. Like, that's not what happens. That's not how medical training works. Like, you don't really learn that kind of stuff. You should probably try something different." And that's when I looked into naturopathic medicine, Chinese medicine, and essentially functional medicine, which kind of brought me to where I am today of focusing on integrative health or integrative medicine, knowing that I've had probably GI issues my whole life. I've had hormonal testosterone issues in my early 20s, struggled with being overweight and obese. So pretty much everything that medicine struggles or everything that pharmaceuticals kind of struggle with treating right now, I've had to overcome without a pharmaceutical. So that kind of brought me here to where I am now. I'm trying to help people and educate people on how can we get better. Take the prescription pad away. What can we do to help us get better?
That story of your dad is such a good picture, though, of like what medicine does versus what, taking more of a preventative and root cause approach and addressing lifestyle really does. And, one thing I always share with people is when you go to Western medicine, they practice medicine, but it is more so like when your dad was probably at a very later stage of a lot of these health issues where, was past having symptoms, but like he was getting to a very crucial part in his health where he really needed help. They would give him medication, they'd get him out of like the big danger zone, but he never really got better, right? It was really just addressing the core symptoms and, trying to get rid of whatever was there that was happening in that moment. But it wasn't overall health. It wasn't treating the garden and addressing the weeds as to why these things came about in the first place. And, it'd be interesting to even hear if any physicians or anyone that he worked with even brought up like lifestyle, like, hey, this is your diet or your nutrition and you're smoking. And I also know men because my dad was pretty unhealthy growing up, but my mom's stepdad, the same way smoker, he's had bladder cancer. We thought he would quit after, having his whole bladder removed. He had like one that was, I forget what it's called, but where he had one that was built for him, actually, a neonatal, is that what it's called, bladder. something like
No.
that. Yeah. Anyway, he had a bladder made from his own tissue for him. We thought that would get him to quit, but like a lot of men are really stubborn too in that. So I know like that challenge also with seeing your parents and like wanting them to really kind of get the picture, like shake them and be like, hey, like this is your health. So I know it's both sides of things, but I also know medicine at the core, it's really just addressing the surface layer. It's much needed to help people in severe cases, but it's very different than functional medicine. And I love the fact that functional medicine and taking more of a lifestyle root cause approach is now becoming something that's a lot more known. It's, before it was like, what is this woo woo stuff? And people would talk about it and they didn't understand it, right? Because that's what we're taught. We're taught, just go to the doctor when something's wrong and then they'll fix it. They'll give you a medication and that's how you go about health. So I appreciate you sharing that story. And I can imagine too, like your own story in that and wanting to probably go the opposite direction quite a bit. I know that was the way for me is like I watched my parents be so unhealthy. My dad suffer with mental health issues, my parents' health. I grew up eating like McDonald's and a bunch of fast food. And I was like, I'm going to go the opposite direction because I don't want this kind of lifestyle for me. But talk to me a little bit about your line of work and what you focus on now, because you have a specific niche in functional medicine. And I love that so many people specialize. Like my practice focuses quite a bit on gut health. We take a gut-centric approach. So I know we'll talk a lot about gut health, but what would you say is the area you like to focus in on first with your patients?
Risk assessment.
Risk assessment?
Yeah, and it sounds pretty boring, right? What does that actually mean? And are we conscious in when we do it? And when I look at a human being, right, or when we are trained as clinicians, we go through this whole, here's this 12-step, 15-step thing that you should do. You get, name, date of birth, weight, height, vitals, family history, medical history, social history, dietary history, uh, all of the above, right? Medications, etc. Um, but what is that really doing? You're essentially acquiring information to use this amazing thing that we have called the human brain that allows us to really look at a human and understand based on our physical exam, based on the assessment, on labs, on all of the things that we can acquire through questions. And then we come up with a conclusion to say, yeah, this person is at risk for X, Y, Z. And when I look at a human or when I look at my patients or when I speak to people, in the back of my mind, my brain is calculating, throwing in formulas that I can't even be conscious of and say, okay, what do I need to do right now to identify the risk of this person's to identify this person's risk for XYZ disease? And that is actually one of the most important steps when it comes to health and functional and integrative medicine. Because when we look at integrative medicine or naturopathic medicine or Chinese medicine or functional nutrition or whatever it is, you're essentially looking at chronic diseases, things that impact your health span and your lifespan. And in order for you to identify how do we undo some of the issues that might contribute to, let's say, heart disease or cancer or chronic gut issues or IBS, what you're really doing is how do we assess this person's risk and what are the risk factors and how do we kind of undo them or prevent them from actually showing up? And that's what I would break down. And that's how I would look at what many people call longevity medicine today, but it's really just evidence-led medicine. Or how do we look at medicine from a health span and lifespan perspective and kind of put all the good pieces together and say, here's all the puzzle pieces, here's the risks, here's the things that I'm noticing for your gut, for your brain, for your heart, for your organs, or whatever it is. And how do I do whatever I can to reduce that risk of that thing being a part of the puzzle that can deteriorate or decrease your health span and your lifespan. That's a very complex way of kind of explaining just how people live a better life and optimize their well-being by not only just identifying, what supplements to take because it showed to do XYZ, but what is really going to be the thing that's going to be your biggest challenge, and how do we get over that? And everyone's challenge is different.
Okay.
Everyone's risks are different.
What would you say are some of the biggest risk factors you see?
Oh boy,
And there's probably a lot.
there are a lot. My first instinct tells me mental emotional health.
Hmm.
That was my first, like when you first asked it, I thought mental emotional. Most people would say cardiovascular, right? What, like most Americans die from heart disease. So you would say, okay, I have to look at your cholesterol levels, your LDL, your ApoB, your any other scans, your triglycerides, etc. Um, Other people would say diet. They would say, yeah, your diet is going to be the biggest risk factor for you, because I also agree, and not to dismiss diet and nutrition. Um, I would say diet and nutrition are up there with mental and emotional health, mostly because they go hand in hand.
Yeah.
But those would be my two major ones of these are the two things that are putting your body at most or at highest risk, or in other words, these are the two areas that you can work on to reduce your risk of multiple diseases. And that really comes down to what you put in your mouth and what you put in your head. And
Hmm.
those are the two things that together communicate, and really comes down to this end result of the body hears what the mind says.
Yeah. So when you're looking at someone, you're doing all of the testing, right? You're looking at their lipid profile, their metabolic health, inflammation levels, you're looking at their gut, you're probably looking at their hormones, thyroid, all of that. But then I'm sure also you're looking at what is your lifestyle like? You're getting to know the person because you can tell a lot intuitively when you really get to know somebody like in a consult, which most physicians just give someone like 10-15 minutes and they're like looking at their chart, taking the vitals, leaving. What are your issues? Here's the medication, or let's just run these extensive tests. And I know that to be true for myself. When I was struggling with all my health issues, like the root cause was obvious. I was like undernourished. I was competing in bodybuilding. I was at a very low percent body fat. And I'm like put on all these medications, for my thyroid and for hormones and an antidepressant. And no one like actually looked at me as like a human and like a person. They were just like looking at all of these like individual markers and then treating the markers instead of treating me as a human. So, for everyone listening to functional medicine, it treats the person instead of just like the individual levels that are off, or, even the core symptoms overall. But getting back to what I was saying is, so you assess all of this and you, based off of the labs, their diet, their stress, their mental and emotional health, you determine which of these will probably impact them the most.
That's right. Yep. And I would always, I agree with you. One of my mentors, when I was first starting school, said, don't be so infatuated with these numbers because a blood test has never cured a patient.
Hmm.
And
Good.
that, I hate to say never, but you know, we can fix numbers, and that doesn't necessarily mean that the person gets better. So we actually have to look at the whole human and understand, where is this person. So one of the first things that I do, and that's why my visits are an hour to an hour and a half, is I ask them, walk me through a day. And this is a very hard question for people,
Mm-hmm.
because I would ask them, walk me through a day. It's like, I wake up, I'll have breakfast. I'm like, hold on, you didn't pee, you didn't poop, you didn't brush your teeth, you didn't shower, you didn't wash your face. Like, I want to know exactly what you're doing. How do you feel when you wake up? What are the first things that come across your mind? What are the first things that you do within the first 15 minutes of waking up? At what point are you getting exposed to outside or nature, or are you somebody who works from home and are essentially stuck in the house all day between four walls? So that is the most thorough question that I would ask somebody, and it gets them to start thinking about their health. And there's a bunch of statistics that kind of go out there, but when you ask most psychotherapists or psychologists or mental health experts, they'll tell you that most of our day is subconscious. If I asked you, tell me where you drove today, and you would say, okay, I drove to the supermarket. Well, did you actually have to think about going to the supermarket or driving there? No, you know that you got in your car, you opened the door, you put in the key, you turned it on, you put it in drive, or pressed the brake, put it in drive, made a left, made a right, etc. Like we're not thinking about that. All of that is just subconscious. So now think about how much of our day are we doing that, but in other instances, right? How much of our day are we thinking about all these other potential triggers that we're not even aware we're thinking of?
Yeah.
Uh, and those are the things that I try to get people to be aware of, because the first step is being aware of them. The second step is changing them. You can't change what you can't track. So if you can track them, then you can help modify them and get people to move in the right direction. So it's a very enlightening question, but it's a very, very thorough and time-consuming question of tell me what your day is like from morning to night. And that by itself can easily be 30 minutes. But
Yeah.
it gives you a ton of information. If you don't do that, you're doing a disservice to every client, patient, consultant that you're working with.
Yeah, we do something pretty similar, and like we have people do the diet recall of what they eat in a day, and some people are like, I don't know, like they don't even know what they've eaten in an entire day, but walking through their morning routines to their evening routines and what that looks like for them. I think that is really important for any kind of health coach to really look at because it's all based off of what we're doing in our day,
I
right?
also, sorry, I didn't mean to cut you off, but I wanted to make the point that I also think that that's why it's hard to treat family.
Mm,
If you live with somebody, you see their every single, not every single, but you see a lot of their habits. So if you see somebody and you live with somebody and they're complaining that they have a bunch of GI issues and they can't figure out why, and I'm thinking to myself, yeah, because every night before you go to bed, you drink almond milk with a bunch of gums and carrageenan and fillers in there, and you're thinking, yeah, that's fine, but that's not even registering with them.
mm,
Or you're chewing a bunch of gum every single day, and you're like, oh yeah, well, yeah, you basically go through a pack of gum a week, right? Like
mm.
those are things
Like
that make
little
it very,
things. Yeah.
yeah, it's the little things. And that's why it's hard to treat family. But you're absolutely right. From a coaching perspective, that brings tremendous value that is undervalued and often dismissed when we look at healthcare today.
Hmm. Yeah, I love that you asked that question. And I think even for us looking at our own life, like we aren't able to look at our day and be like, okay, this is what's causing my anxiety levels. This is what's causing my insomnia. This is what's causing my sleep. So I think it's really powerful to have somebody like you with your background in holistic health and functional medicine as a physician to be able to say, hey, here's probably what are some of the core things that we can work on shifting and changing first, right? And it always comes back to the lifestyle side of everything every single time. So I agree with you on the mental and emotional side, and then on the dietary side, and really making the shifts and the changes there. And then too, like our mental health is always going to influence what we eat. Like most of us now, like we know what we should be doing in terms of nutrition. Like there's little things like people are blown away when I talk about like the almond milk thing, and they're like, wait, gums and these things are not good for us and our microbiome. And like that kind of information, I will say, is not very well known by most people, especially what things can maybe be gut disruptors. But overall, I think like a lot of people know like what they should be doing in terms of eating healthy, but it's the mental health, it's their lifestyle that really gets in the way.
So many of you guys know my story of losing my health, dealing with hormonal imbalances, thyroid issues, depression, anxiety, and gut issues that were so severe. I almost had my entire large intestine removed, and Western medicine completely failed me. They gave me trash can diagnosis like IBS, depression, gave me a bunch of medications. And, if I wouldn't have taken my health in my own hands today, I would be without an entire organ, like literally. And that's why I created what I wish I had, what I needed, a holistic mind and body approach, a functional medicine approach that said, why do we have this problem in the first place? And what can we do to restore function? This is the difference between thriving instead of just surviving and managing your symptoms. So if you're somebody who is sick and tired of being sick and tired, dealing with stubborn gut issues or hormonal imbalances or weight loss that you feel like is not moving anywhere, or thyroid issues and autoimmune condition, there is hope. There is another approach. And me and my team of registered dietitians, we want to help you. We want to be the support there for you. We want to do the functional medicine lab testing, look at your gut, your hormones, your thyroid, your adrenals, deficiencies, toxins that you can have in your body, get to know what you're doing with your nutrition, look at your lifestyle, look at your previous medical history, and help you create a customized plan to not just only heal, but get to the best health of your entire life. So if you're somebody who's ready to take a root cause approach to healing and step into the best version of you, fill out our application on our website, rachelscheer.com, and book a free 30-minute call. Absolutely free to do this call. Our goal on this call is to better get to know your goals and how this approach may work for you. So click the link in the show notes and book a free call if you would like to learn more.
Yeah. And because they're doing most of it unconsciously or subconsciously, and bringing that to their attention is an art, and it can be triggering. And I'm sure you go through this many times when somebody's trying to get their body fat down or improve their visceral fat or just get to I usually say look good naked, right? That's just what people want to do. They want to be able to look in the mirror and say, oh, I feel good about myself. And you go through their day and they're like, oh, I skip breakfast. I have a salad for lunch, and dinner is
Coffee for breakfast.
Coffee for breakfast,
Yeah.
right? Hopefully they're not putting a bunch of other crap in there, but let's say it's coffee for breakfast. Lunch is a salad, dinner is meat and veggies. And you're telling me that that's all you do and it's not working. So then I question myself, and I don't go to this. Most clinicians will look back and say, well, you must be overeating. You must be doing something wrong. Sure, I'm probably missing something. As a clinician, I am missing something, and I take responsibility upon myself. It's not the patient is coming to us for the as we coach people, they're coming to us for help, to help live better, to improve their health span, to improve their lifespan. And if they were not there, if they didn't want help, they wouldn't be there.
Mm-hmm.
So because they're actually coming to you, you have to then first do a self-evaluation and say, am I the one who's missing something? Am I not asking the questions right? Or what is the blocker here for this individual that's not allowing me to get into really a deeper part of understanding, well, what else is it that's contributing to their weight gain if really, truthfully, all they're having is a salad and meat and veggies for dinner? So then you have to go deeper. Okay, well, is there a stress component? Is there a dietary component? Is there a hormone component? It could essentially be anything that is in that long initial intake, and you have to really double click on all of those.
Yeah.
And that's
Maybe
where
alcohol, and they're telling you what they eat, and then they're not mentioning anything that they're drinking.
Absolutely. I was telling my students the other day, they're young dietitians, and I was like, we do case studies, and I said this individual said that they're consuming 3 to 4 drinks a week. And I asked them, I'm like, do we really think that that's actually accurate? Because whenever I go to a restaurant and I get a glass of wine, it is not 5 ounces of wine, right? So they're always overpouring, and people underestimate how much they drink, and they underestimate how much they eat, and they also underestimate how much they exercise or how hard they're pushing themselves. But it's part of us, it's part of our role to ask the right questions and be supportive in that, and also understand that there is a mental component to it. And to empower people to take ownership of their own health is a bigger task than we actually think.
Yeah. And sometimes I will say like the testing can be empowering for other people too, like when it is all lifestyle related. And I think that's what's so cool about this work is when, you're someone who can look at lab tests and see that you have high insulin and that you have inflammation. And then you, as the practitioner, is able to say, like, I think a lot of this is stemming from your diet. You're low in your omega-3 fatty acids. You have a lot of inflammation. Here's what we're seeing that's happening in the gut. And then when we look at your nutrition here, yes, you're not overeating. Well, I guess you would be if insulin was high, but we're able to look at the overall picture and tie it back to the lifestyle. I think for a lot of people too, that's what's really empowering, is being able to see the lab tests tied back to the lifestyle and be like, oh, I need to actually make some of these shifts and changes because I thought it was my hormones. And yes, maybe I have some estrogen dominance, but why do I have estrogen dominance? It's because I'm overeating. I have, high levels of inflammation in my body. My bacteria is off in my gut. So I need to, yes, do some of these protocols, supplements, all of that. That's incredible. But most importantly, I need to address my nutrition and I need to address the lifestyle side.
And you change what you can track. So when I do blood work on my patients, they're sometimes overwhelmed, but they're also grateful. And they feel like somebody's actually paying attention and looking a little bit deeper. So yeah, I'm doing insulin. Yeah, I'm doing oral glucose tolerance testing. I'm doing also omega index testing, uh, all of the hormones, right? If you don't know what's going on, then you're kind of just shooting in the dark and hoping that something sticks. So it does require a very thorough approach, but also going through that and being able to explain it is very challenging. And many of my patients will go to their doctor and they'll say, I want to get this done. And the doctor will say, nope, we're not testing that because there's no evidence behind it. Most of the time it's because they don't know what to do with the answer, right? If I went and told you, let's say you didn't know anything about insulin and your doctor didn't either. And I said, go to your doctor and ask them to check your fasting insulin. And you didn't know that that was actually really, really important. And your doctor said, nope, not really important. I wouldn't do that. How would you respond to that? You would have no resource.
Oh, okay.
Yeah, okay, fine. I trust you because doctors are an authority in society. But I love that my patients and a lot of people on social media are starting to become educated, sometimes overeducated in some areas. But I think it's important for us to start considering all of the variables rather than just saying, no, not really worth it because it's not going to change it. And let's see. But also, I tell this to a lot of my younger patients, sure, I don't think you have a testosterone issue. I don't think you have an insulin issue, but I want to check it now because in 5 years, if you do, I know that it's changed. And it's all about trends. And it's kind of like the stock market or, finances. You have to identify the risk and you have to identify the history and the trends. Otherwise, you're just taking it at a point in time. And that's not going to be helpful in the long run if somebody wants to live well for most of their life.
Yeah. And I even know for like the clients that we work with, like there's definitely things our clients bring to us and they're like, I want to test this, this, this. I think this is what's off. And like we have an intuition at this point of like, I don't think that's what that is. But also, like it's our job to be able to validate, and they have questions and they want to know. And maybe you run the test and it comes back in, hey, this isn't what's playing, the big role here. But I think that's also totally okay if someone really wants to get answers and they're set on this is what's off, this is what's wrong, and you can help get rid of a lot of that those conversations that are going through their head, because ultimately they're just trying to get better and we're just there to help guide them in the right direction too.
Yeah. And a lot of these markers don't show up or they show up or the typical markers don't identify an issue until the issue is actually there. And in terms of risk assessment and trying to identify somebody's risk, the goal is to identify those things before they show up. So if I was counting on fasting blood glucose as an indicator for identifying if you're insulin resistant or not, I'm only going to catch it when you are insulin resistant. Mm-hmm. But I'd rather test your insulin, which can tell me 5 to 10 years before you're in the pre-diabetes stage. And that allows me to be more proactive and say, hey, this is actually an issue. I've identified a problem. We need to get ahead of this. And this can be a possible cause for your joint pain, for your PMS or your irregular menstrual cycle, or the fact that you are having difficulty losing weight, or why there's fat on your liver. All of these things are very important. You just need to know how to read them and how to look at them appropriately.
That makes sense. So, in terms of longevity, because I definitely want to go there, so I'm switching gears here a little bit. But what I understand about longevity, right? It is age optimization from the moment that we're born. Like we're aging. It's part of life, unless we're Benjamin Button. And part of age optimization is preventing more so premature aging and then also optimizing our health span. And then I'm sure also looking at some of the big risk factors to preventing that along the way. What are some of the things that you see that cause premature aging and more so shorten that health span with people? Is that more the mental side of what you were talking about, mental, dietary, but like what's off in causing that premature aging?
Yeah. So when we look at the human body, it's very, or should be very resilient. And that's one of the fascinating things about biology is that we think we know the body. And I usually tell my patients, we know more about the Milky Way than the microbiome. And we really don't know a lot of things that go on in the body. There are some drugs that we think we know how they work, and we're just then find out, well, that actually works completely different. Um,
Mm.
Example, Ozempic, right? Very hot, or semaglutide, a very hot medication right now. We think we know how it's working. I suspect that it's more central nervous system, but yes, it does have an impact on the microbiome. It does have an impact on the gut. It has an impact on your hormones, all of these things. But it was originally used for its ability to secrete insulin in the body and allow you to be more insulin sensitive. That doesn't explain why people lose so much weight on it. Also doesn't explain why people lose so much muscle mass on it as well. So um, when we look at somebody's health and trying to identify these things as to how we're aging, the first thing is to look at the human body and identify why it's not resilient. That's the first step. And most of the time, it's because we're constantly chipping away at our resiliency or decreasing our threshold for us to be tolerant of environmental factors. And the second part is erosion, natural biological erosion that happens without us even thinking about it. And that's kind of what aging is. So when we have heart disease as we age, so the risk of having a heart attack or a major adverse cardiovascular event increases significantly in your 50s, 60s, and 70s. Why? Because it's an engine and it's constantly being worked on and constantly being strained. Now, there's things that we can do very early on to mitigate that risk. And for my math nerds out here, my statistic nerds out there, it's essentially what we call area under the curve. So if we decrease the area under the curve, if we decrease the exposure over time, then you're essentially decreasing the strain on the body or the amount of erosion that's happening. So the way that we look at aging or mitigating aging, I don't like to say reverse aging or anti-aging, right? We're going to age in a healthful way, is trying to identify those things that are slowly eroding, kind of like how our water erodes at a mountainside or a cliff. And if we can reduce the amount of impact every 5 seconds, and in biological terms, that could be every millisecond, that could be every minute, it could be whatever it is, right? Depending if it's like your mitochondria or whether it's your heartbeat, whatever it is, those are things that are going to be necessary to reduce our risk of multiple diseases. So those are the areas that I would look at and say, okay, let's say we want to reduce your risk for heart disease. What are all the factors that I need to look at to mitigate the erosion, the biological erosion that's happening, and also increase our resiliency or our threshold? So I would have to look at your blood pressure. What is your heart rate? What is your cardiac output? How resilient is the lining of your arteries to be able to withstand some of this excess pressure? What are the things that we're doing to reduce inflammation on the arteries, to reduce any type of wear and tear that might not necessarily want to be there, like homocysteine, HSCRP, uric acid, ESR, insulin? All of these factors are going to play a role because they are slow eroders. I don't know if that's a word. Is that a word? I hope it's a word.
Rotors, yeah.
Uh,
I don't know.
we'll just count it, but they're erosion agents. And that's how I look at health. So another thing would be Alzheimer's. Well, let's look at all the things that might contribute to Alzheimer's.
Blood sugar.
Blood sugar, exercise, low BDNF, increased
Megas.
cortisol, all of these things,
Yeah.
infections, poor microbiome health, how that impacts the gut-brain connection, environmental toxins, all of these things, they're eroding and essentially chipping away at the body. So you have to really have a hyper-focused attention on a few little things. And when you combine them all together, the end result is a better you, is a better system. So if your car's not working fine and you think it's not driving right, and you think the only issue is the tires, you don't look at the axle, you're never going to get your car to drive smoothly. And that's kind of how I look at the body.
Yeah. So if I'm someone who's listening and I'm like, okay, but how can I optimize what's the word I'm looking for? I want to live as vibrant and energized as long as possible. And I want to minimize getting wrinkles and looking old, because we've seen people who are like in incredibly great shape. They vibrant, their energy, their skin's pretty good. And we've seen people who are, like we've met someone who is younger, but looks really old. So if you were to like say top tips for somebody to mitigate premature aging and a lot of that erosion and things that they should be focusing on in their lifestyle, nutrition, what would you say are the big areas for people to do, or any like cool hacks?
I would say, aside from cosmetic stuff, right? Things that
Yeah,
you would put
like
on top of
internal
it.
stuff. Yeah.
Yeah. So let's talk about internal things. Number one is sleep. It is the ultimate rejuvenator.
Yeah.
There is nothing more evolutionarily necessary than sleep. If that were not the case, then we wouldn't have a lot of the diseases that we have now, where you could argue many of these chronic diseases are attributed to poor sleep quality. Just look at sleep apnea. That impacts heart disease, that impacts diabetes, that impacts hormone levels, weight loss or weight gain, etc. So number one would be sleep. You need to not just get 7 hours of sleep, you need to get 7 hours of refreshed sleep.
Yeah.
So that would be number one, and we can definitely go into the details on that. But I would look at things like a PSQI, an Epworth scale, and a stop bang. Those are 3 surveys that you can take that'll allow you to assess how good is my sleep quality. I do love Oura rings, Whoop, Apple Watches, all of the above. They're great, but these surveys are validated questionnaires, which are really useful.
Which would you like better? The surveys, or because the trackers, they can look at deep sleep, REM sleep, light sleep. And I think for a lot of people who are like, yeah, I'm sleeping 7 hours a night, but then they're getting like minimal deep sleep or REM sleep. It's looking a bit at that. What would you say is the difference between using a tracker to look at that and then doing more so one of these surveys? But I'm not familiar with the surveys, so.
The surveys are a better indicator of feeling refreshed.
Okay.
It's better of a subjective type of feedback of, am I actually feeling like I slept well? And that's not to be dismissed. So if somebody said they slept 8 hours and they feel refreshed and they feel great the next morning, and they're getting a Aura score or a Whoop score or Apple Watch score that's saying, nope, your sleep was horrible, don't go exercise today, I would argue that you should probably question that, because your body, you have to listen to your body. So that's where I would have to kind of consider both, but you have to listen to what your body says.
I used to wear an Aura ring and it would give me a bad score, and I actually would feel okay. And I would inevitably feel like I was having a bad day after that. I was like, no. And it would
Yeah.
mess with my mind. So that I had to stop checking it so much.
It throws you off. Absolutely. So sleep would be number one. Number two is nutrients, not just nutrition, but nutrients, nutrient density. And that also means caring for your gut, caring for your microbiome. Our gut gets first dibs, then our body. So if we eat something, let's say we eat dark chocolate or an apple or pomegranates or green tea, some of the nutrients in there, the phytonutrients, the polyphenols, the flavonoids, the catechins, um, the fibers, we don't absorb them. They are metabolized by our microbiome or by certain enzymes on the surface of our cells, and then our body takes them in. And if that is not optimized, then all bets are off because the gut is a representation, or I would say the way that our body feels is largely correlated with the health of our gut. And if we have intestinal permeability, if we have inflammation in our gut, I've seen a bunch of your stuff where people are super bloated, and there's no way you're telling me that somebody can feel that bloated and feel well.
Yeah, no way.
But you can tell me that when you reverse that, they feel like $1,000,000. And that is often emphasized in colic children or babies. A colic baby is very difficult to manage because they can't communicate and they're usually uncomfortable with their gastrointestinal tract.
Mm.
You solve that and it's like new. They're like brand new. So sleep and nutrients would be my number two, my top two. And then my third is obviously, which is underestimated, but reducing your or creating boundaries to reduce your stress. Oftentimes,
Boundaries to reduce stress.
yeah, boundaries to reduce stress.
What's
Yep.
that mean?
It means saying no to stuff that you know in the end is not going to be good for you.
Mm.
So what we often do is we will say yes because many of us are people pleasers.
Mm-hmm.
And no is a bad word to many people. I can't say no because they did a favor for me before, or I can't say no because they're going to be upset. I don't give a shit. Say no because you are more important than anything else that's going to have an impact on your health. And that's really hard to say.
I love number 3. That's a great one.
Yeah,
How do
it's
you do
tough.
that? Boundaries to mitigate stress, saying no more, using the no button. Seriously, though, I think that's one. And I love that you talk about that as a practitioner, because I think we can talk about nutrition all day long, and we do address nutrition, and we can talk even a bit about sleep. But at the end of the day, like, we're all stressed, like we're stressed AF in our lifestyle. And we need to be able to say no to more things. I know for myself as an entrepreneur, I used to be like a yes woman. It was like any opportunity I got, saying yes. And I know the busier I've gotten, the more I've realized how important, for me saying no and prioritizing sleep truly has been, just because my stress levels have only gone up and up and up. So I like that you mentioned that. So by people optimizing sleep, but like quality of sleep is what he's saying here. He's not just talking about like time in bed, because you'll also realize too, like if you start to track your sleep and pay attention to it, oftentimes we think we're getting 7-8 hours of sleep, but we're really actually not. We're not getting the quality sleep. And there's a lot of really interesting information out there about how you can start to like hack your sleep, like paying attention to your caffeine intake. Like I have to cut myself off at I think like 1 p.m. Otherwise, I don't sleep well. I used to be able to drink caffeine late at night, but now I can't. I have to have boundaries, like that, boundaries with my phone, technology boundaries. I put my phone up and I'm like, we're done. We're not looking at you. We're not doing TV, any of that. I have to start to like have boundaries too with like just really with work too, like winding down earlier. So there's a lot of things you can do lifestyle to improve sleep. I think sometimes people think it's just getting into bed earlier, but it's also to like what you do throughout the day, what you're doing in the mornings and afternoons, and what that looks like. That also really impacts the sleep side of everything.
Absolutely. And it's being ruthlessly selfish with your mental health and well-being.
Hmm.
And if you don't do that, nobody else benefits. Nobody likes a cranky mom or a cranky husband or a cranky brother or friend. You
So
have to be selfish.
yeah, I agree. So there you guys have it. Be more selfish if you want to feel better and age gracefully with your
It
health.
sounds aggressive. It sounds rude. but it's honest.
Yeah. I think more people need to be selfish with their health. Truly.
Absolutely.
If you want to really feel good, get better, you have to start caring about yourself. And we attach selfish as being negative. And sure, there can be certain contexts, but also you can't show up for the people in your life that you say that you love if you're not at your very, very best.
Right. You put the oxygen mask on for yourself first, and then the passenger next to you. That's just, it's a cliche metaphor, but it's true. And if you don't do that, or if you try the opposite, you're going to be disappointed at how difficult it is to get your body or your mind into the right space.
Yeah, I agree. So you mentioned a bit on gut health in terms of longevity, and I want to be respectful of your time here. I only get you for a little bit longer, but let's talk a bit about hormones. Hormones in terms of longevity. Right now, we're at an epidemic of low testosterone in men. I feel like every guy has needing to get on HRT. It's the norm. And also women too, women struggling with hormonal imbalances. I think PMS, 75% of women suffer with PMS. And then they're just given birth control to get rid of their PMS symptoms. And it all does come back to lifestyle. So talk to me a little bit about hormones' role in longevity and what your approach looks like.
Yeah. I'm not the person who says that your hormones need to be at the highest level absolutely possible for your entire life. There's many factors that are involved when it comes to testosterone for longevity, for estrogen for longevity, growth hormone, insulin and cortisol are hormones as well. But let's kind of focus on the sex hormones. When you look at testosterone for men, yes, testosterone levels are declining. Instances or prevalence of sexual dysfunction is increasing. Prevalence of male infertility is increasing. That should be a huge wake-up call that something is happening in our environment or in our society that's impacting the health of men and women and humans.
Mm-hmm.
And when I look at somebody's longevity or trying to improve their resilience or decrease the amount of biological erosion that happens, hormones are one of our major protective molecules. Testosterone helps improve vasodilation, so it helps with our blood flow, it helps with our arteries and veins and dilating, it protects them. Think of taking a rubber band out of the freezer. You stretch it, it's going to break. Well, testosterone helps mitigate some of that stretching that might happen or some of the cracking that might happen on the vessels. That's why a lot of men who go on testosterone, they notice improvements in sexual health because it's improving blood flow to the pelvic floor. So testosterone has that significant impact in men, but also has a cognitive benefit. And one of the prime instances of this is when I did my internship at NYU Urology, a lot of the men who went on a therapy called ADT, androgen deprivation therapy, for prostate cancer, arguably the right or wrong approach, but that was what the proper approach was at the time. Their mental health decreased. Their cognitive capacity decreased. They were less focused. They felt mentally unwell. And that's because you essentially castrated them and removed all testosterone from their body. You also removed estrogen. So estrogen has a cognitive benefit as well, and has a benefit on the lining of the arteries. Also has a significant benefit on bone density. So why am I saying that? Well, look at the things that kill Americans. It's heart disease. So we talk about the blood vessels. We talk about cancer. So imbalance in certain hormones can have an impact on prostate cancer and breast cancer. And in fact, it's more likely that low testosterone rather than high testosterone is a risk factor for prostate cancer. When we look at bone density, what do most people die of if they're in their 70s and 80s? From a fall. Mm-hmm. So bone density increases risk of fractures. Sarcopenia, muscle wasting. If you don't have enough muscle mass, you can't climb up those stairs. And if you don't have the muscle and the neurological function to react, you're going to fall and hurt yourself.
Yeah. And
So
then the metabolic effects from having low muscle mass too. So, yeah.
absolutely. So how could I forget that? Yes. So testosterone's impact on metabolic health and insulin sensitivity, and in fact, estrogen as well. So a lot of women who go on birth control or hormone replacement, they get very sensitive to
Mhm.
the hormone replacement and they become insulin resistant. Whether it's the estrogen or the progesterone, it varies. In some women, it can go either way, but in most women who go on birth control or HRT, they notice they start gaining weight. Some of that could be water weight, but a lot of that is because it's promoting insulin resistance. And that actually is more of a personalized. I haven't seen it be all or nothing. Like not every woman who goes on HRT experiences that. But I would say about 20 to 40% of the women that I've seen on HRT actually have issues losing weight while they're on it or after. But
Mhm.
then there are some that do pretty well on it. And that's more, I think,
Testosterone specifically.
I'm sorry.
Testosterone specifically.
No, estrogen and
Or for
progesterone.
estrogen.
Yeah,
Estrogen, progesterone. Okay.
yeah. And there are men who will go on testosterone and will gain weight, and a lot of that is water weight. Um, but it kind of goes both ways. And I think that's a reflection of the clinician and being aware of this person. And are these things actually a risk or a cause of their metabolic health or not? So if you're going to worry about your longevity, you want to optimize your hormones, whether it's synthetically or organically or endogenously.
Okay. So you're a fan of HRT.
And the right women and the right people for men and women, yeah, I think it's totally appropriate. I don't think it's for everybody. I think there are a lot, and in fact, there are some people who will go on HRT and they don't feel better.
Yeah.
So it's not the panacea or the end all be all.
Why do you feel like testosterone is declining so much? You mentioned like the environment.
Yeah, I think there's a lot of environmental toxins that we're not aware of that we're being exposed to. I think also our society is moving through a different way of living, and there's a mental and an emotional aspect when it comes to male testosterone. I'll give you an example. When I was in my 20s, I experienced low testosterone. My total testosterone was around like 200 nanograms per deciliter. That's really low. And it
Yeah.
was a very stressful time. I was in med school, or I was finishing up undergrad. I was going into med school, naturopathic school, uh, issues with home with my father, right, and his health, a bunch of other issues with the relationships. And once I created these boundaries and sucked the poison out, my hormones got better without HRT, but it did require adaptogens, it did require some supplements, it did require dietary interventions to get all these things right. Um, but we're we're underrepresenting the impact of mental health on sexual health and on hormone health. So I don't think it's just environmental toxins. I think that's where a lot of the attention goes to, but we should be paying a lot of attention to mental health. And we know mental health is an issue. If you watch the news, it's
Mm.
on the news like every week. There is a mental health issue that we are absolutely ignoring in the United States and worldwide. And the hidden clue or the hidden symptom is a lot of the hormonal symptoms that we're seeing both in men and in women.
That's super interesting. I think I can't remember where I saw this statistic, but it was saying that the average young adult has the same level of anxiety as a psychiatric patient did in the 1950s, right? And so, I mean, I feel like that's a very big overlooked piece of the puzzle. And I know in the line of work that you do and I do, it's not ever against doing HRT or that, but it is also saying like, hey, I think the stress is probably playing a really big role. And Dutch testing is awesome for that. I know you know quite a bit about Dutch testing, about doing a full 24-hour cortisol awakening test, looking at your adrenals. That can also be a pretty big indicator of stress is playing a role. I actually a while back came back with high testosterone, high DHEA, so opposite. But I also can look back at where my stress was at that point in time. And normal Western medicine would have probably said I had PCOS, and like looking at the PCOS criteria, like definitely zero insulin resistance, like not any of the skin issues or anything like that, but I did have high androgens. And, for me, I knew right off the bat, just in this line of work, I'm like, oh no, this is all stress related. With everything that I'm going through. And as I was able to work more on stress boundaries and saying no, prioritizing sleep, my testosterone levels did go down. However, I lift weights a lot. So it also makes sense that it was a bit higher. But it was so interesting when I was competing and had a very low percent body fat, I had like non-existent testosterone levels. It's just like a byproduct too of that stress and metabolically where I was at, and my body just lowering all of its hormones altogether. So
We could do a whole podcast on stress. And I think the proof of that is when people say stress, I'll say which one: metabolic stress, physiologic stress, psychological stress,
dietary stress.
trauma stress,
Yeah.
sleep stress, financial stress, relationship stress. All of these things are stressors, and the brain doesn't know the difference. It just knows bad, unwelcomed, don't want it, need to respond to improve our resiliency. Otherwise, we're in danger. And we need to figure out how to get a hold of that. That's why I like adaptogens. That's why I like meditation. I like acupuncture. All of these things together are going to have an impact. If we look for just one golden egg as the solution, you will be disappointed. It takes multiple different approaches, multiple different targets to get the body to move in the right direction, because it's way more complex than we think. So for a very complex body system, we need a very comprehensive approach.
Yeah. Do you like using supplements like maca and tribulus, things like that for boosting testosterone? And have you seen good results?
Maca does not improve testosterone levels in men, but it will improve libido. Tribulus, I have not seen much benefit with it, truthfully. A lot of the herbs that I use for testosterone in men, DHEA is not an herb, but it's a precursor. Ashwagandha. I like Urcomia longifolia, also known as tongue cat. There's quite a few herbs that can be helpful, but it really depends on the individual. Panax ginseng doesn't impact testosterone levels, but can improve libido. But oftentimes we're trying to understand why is testosterone low. And usually the target is, and usually the target is the thyroid, insulin resistance, or cortisol.
Yeah, it's like adaptogens are great. I take ashwagandha every single day, but if you don't still deal with the lifestyle factors, it's only going to do so much, and it can help you get through a short period of time. I had on my podcast a while back Dr. Carrie Jones, and she was talking a lot about adrenal protocols. And she said that she wasn't really for doing a lot of adrenal protocols, not necessarily against it, but she never did it on herself when she had some adrenal issues. I can't remember if it was high cortisol, low cortisol with what she was struggling with. But she didn't do it because she's like, I know what I need to do. I need to, this is all lifestyle related. I need to fix, what I'm going through in my life. I know I'm going to make those changes, but a lot of people get very set on the supplement for doing all of the work for them. I'll just take, this adrenal protocol, the vitamin C, the adaptogens, which are great, do them, but it should always be paired with, okay, this is a wake-up call for dealing with the stress in my life and really figuring out what that is.
We live in a Western culture where we expect a pill to solve things. And just because it's a natural or naturally occurring capsule doesn't necessarily mean that it's always right and always the right solution. So I think it's also being honest and identifying that just because, this adaptogen is natural and there's this whole protocol, it doesn't necessarily mean that it's the right thing to do. And I agree with Carrie. I think protocols are a one size fits all. And there's never been one thing that I've prescribed to somebody that has been identical to another person. They're always tailored to the individual. And that's actually the fun of medicine, in my opinion.
Yeah, a lot of intuition is definitely used for sure. Well, this has been an awesome podcast. Didn't even get to all the questions that I wanted to, so I'll have to definitely have you back on. But last question I have for you: what does your day look like?
You're throwing it back at me, huh? I could spend a half hour going through that, but essentially
high level.
Um, First 30 minutes is getting ready for the day, preparing myself mentally, reflecting on how I feel. That might include a meditation or not. It could just be, how do I feel today? How are things going? Do I need to rest? I always expect myself to lift or exercise at some point in the early morning. And then I evaluate, do I feel like my body's ready for this today? Because I think motivation to exercise is a good indicator of whether you should go after it or not. Um, and then I like to spend time alone in the morning. I don't want to be disturbed by emails or phone calls or
Mm, same.
chatter. It's, I like to read a few newsletters. I'll catch up on some things that I missed in the news. And then I'll train. I like to train, and that sets me up for the rest of my day. And then after that is a nice high protein meal following my exercise. And then for the rest of the day, I'm working and it keeps me in a very focused um, mindset for the rest of the day. And then I try to turn off around 6 p.m. and spend the rest of the night with my wife or friends or family and just have some downtime because we have to keep that balance. Otherwise, you'll burn out.
Mhm. Do you train fasted?
I do. I can't
Yeah.
train after eating. It's my history of IBS. It doesn't work for me.
Yeah. Okay. So train fasted. What time are you normally up in the morning?
Between 5:30 and 6.
Okay.
It's
So,
a little bit of an early bird,
yeah, I'm the same
but
way.
it's the only time that it's quiet.
The best thing I ever started to do for myself was not setting an alarm. And this is something I did recently because I've gone through phases of burnout just as entrepreneur running a business. I also think women like really need to understand their cycle too, especially in the business world. And learning that has helped me a lot because for me, I just like used to plow through and push through different periods and not really paying attention to that on an energetic level. Um, but what I'm really hearing from you is you spend a good amount of time in the morning listening to your body. Like, how am I feeling? Checking in with myself. What do I need today? Is today a day where, I can maybe push a little bit harder in the gym? Is today a day where I need to kind of give myself some rest and really tuning in? And I think if more people were to do that, it would play just a massive role, and I think it is hard for us to do that and really get quiet, ask ourselves what it is that we need at times, and then also honoring that too. Sometimes we're like, no, I have this workout planned. This is what I'm going to do. And we don't listen to it. And our body always gives us pushback later on. And I love that you mentioned that overall. So it's been awesome having you on the podcast today. Where can people find you? Check out all that you're doing.
Instagram at Dr. Ralph Esposito. The website is Dr. Ralph Esposito. Twitter is the same. Those are the three major areas you can find me.
All right, we'll put all that in the show notes. And if you guys enjoyed today's episode, take a screenshot, share it to your story on Instagram, tag Dr. Ralph Esposito, tag me, tag the Scheer Madness Podcast. Let us know what you enjoyed from today's episode. And this has been Scheer Madness.